Hi everyone. So I'm Karen Igho, and as Sally's already said, I'm a project manager at Healthwatch, and I'm going to tell you about our digital inclusion project that we did with our community researchers. And as we go through, the pictures that I've used are all of our researchers, so I'd like to point them out because they're the really important people that did all the work. So you can see there a selection of them on the screen, and we spent the day at Black History Month in Peterborough collecting data for this project, and this was us afterwards in going for a coffee and a big rest. So our first project, the thing that we did was we came together as a team, I guess, to recruit people to come and help us with this project. It was a collaborative effort between Healthwatch, Cambridgeshire and Peterborough with the North Care Integrated Neighbourhood team. We recruited 13 community research volunteers, and we started collecting data after the recruitment and induction in June 2023. I guess what was quite important about that is that it was a co-produced piece of work between the integrated neighbourhoods in the North Place and the volunteers that were recruited. We went out to find the type of things that people were talking about, collated that from Healthwatch Intel, and the top two things that came up were pharmacy and digital inclusion, and our research, sorry, our commissioners decided that we could work on digital inclusion. This is a watered down timeline for what we did. We got the topic agreed in June 2023. Then we worked on getting the survey developed and went on to test the survey, first of all, with a couple of coffee mornings that we went to in Wisbech just to see how that worked with people. The survey was completed throughout December and up until December, and we collected 400, we're just short of 400 responses. The data was compiled and the report was submitted in February, and you can see a picture there of Kelly, one of our community researchers. So, as I already said, it was collaborative, co-produced piece of work. We had a comprehensive communications plan. So this did go out through more today traditional methods. So out through like online communications, networking, posters that were put up, leaflets that were left around, and people were able to get involved there. I think one of the main things about this project is the majority of responses were from our community researchers going out and speaking to people. So this could have been in coffee mornings, as I already mentioned, but in doctors' surgeries, at different events and so on. And that way we were able to collect data from people that perhaps wouldn't have otherwise been able to take part. So moving on to sort of the key recommendations. And these have been taken up by the commissioners, and they've said they're going to consider all of these in work that they do going forward. And last week I presented these actually to the forum of professional workers at the ICB, and they're looking into that and taking digital inclusion very seriously. So some other similar to this, with people have got the power to make changes, which is really important. So if I start going through the key recommendations, the first one you can see there is enhancing digital accessibility. So this is around recognising and respecting the choice of individuals who prefer not to use technology. And it was one of the things that I was most surprised about when I was out and about talking to people, because I've made a massive assumption that people that aren't using digital for healthcare were perhaps people that couldn't use it. but it was a lot of the time, or didn't have access to it. We did find people like that, but there were some people that could use it, did have access, but they just didn't want to use it for healthcare because they felt it was too personal to a thing to be using it for. So we think that people should be provided with alternative options for accessing health and social care, although increasing awareness of digital services among the population is really important to ensure inclusivity. Um, the second one we have there is improving user-friendly design. So simplifying and streamlining digital platforms to make them more user-friendly. So particularly for the elderly and those with limited digital literacy. And since this come out, there has been more of a move towards using the NHS app more, and more people use it. I can't remember the figure off the top of my head, but I think people using the NHS app to get a COVID pass and then using it because they wanted to travel was made sure that lots of people have got it and are using it now. So this is really good. And there's moves across the healthcare system for more emphasis to be put on using that NHS app rather than lots of different ones. Flexibility in service and delivery. So there's a need to offer a mixed model of service, allowing individuals to choose between digital, telephone, and face-to-face interactions and their preferences. And I think this is one of the most important points that came across to us, is that people will use digital if they can or they want to, but there's always going to be a group of people that can't or don't want to. And we need to make sure that those people aren't excluded. So there should continue to be options for booking appointments and so on, rather than just doing online. One doctor's surgery that we went to, they only do bookings by email now. Consequently, people phone up, ask for a booking, and they can't get one. They're told to go online and book one. They don't have access to that or don't understand how to do that. So then at 9 o'clock every morning or 8:30 every morning, there's a big queue out the door of people wanting to make appointments because they don't understand the online ways of doing things. Yeah, so it's really, really important that healthcare providers know that they need to just make sure they include everybody. A lot of the people that I spoke to were scared of using it for their healthcare. They were scared of scams. They didn't know if to trust when text messages came through to them and that kind of thing. And providers need to make sure that they're going along with that and taking that into consideration. So that leads on to kind of education and training for people. Implementing training programs to enhance digital literacy is really important, especially among older individuals. And I know some of our Healthwatch community researchers have gone to their practices and are doing sessions with people, and libraries provide these. But this needs to be stepped up a little bit. And even though it happens, it's difficult to make sure that everybody knows when and how things are happening. So we went and did some data collection at Sawtry, for instance, in a community hall there, and I was really pleased when I went in because I saw on the board there was a poster up saying we're doing digital inclusion training here for people, and yet two people that I spoke to there collecting data for the survey said it'd be really good if we had somewhere where we could go and get some training, and they were in a building where it was offered and there were clear posters up. So it's difficult to always let people know. We need to ensure seamless integration of medical records across different healthcare services and platforms. And people need timely updates and notifications. And digital platforms need to be up to date. And these aren't always taken as a priority, particularly within doctor surgeries. I've found with some other work I've been doing with PPGs. Finding up-to-date information about PPGs on doctors' surgeries websites isn't always easy. And when I've spoke to those PPGs, they said it's just not prioritised and there isn't the team that are able to do that. So I think healthcare providers need to really work on making sure that what they're providing for us digitally on websites, on their social platforms and so on is up to date and kept up to date. We need good accessibility for vulnerable groups. We have to consider the needs of the population of people with disabilities. I mean, in some ways, perhaps someone who's neurodivergent will find it easier to interact via digital technology. So it's not like everyone isn't using this. We just need to make sure that people that can't or really don't want to aren't left behind. We need good feedback mechanism and continuous improvement, access, and we need to address technical challenges. So tackle technical challenges such as network issues, glitches on websites and so on. So we're continuously improving the overall user experience and providing support for individuals facing difficulties in accessing digital services due to technical reasons. But then, you can't always, as I've proved just now, you can't always allow for that because sometimes things just don't work properly. Often it's the human behind the screen. And maintaining that human connection, so acknowledging that the importance of in-person interactions in healthcare. We need to ensure that digital advancements do not compromise the human touch in healthcare services. So, in conclusion, I think engaging community researchers is crucial for co-producing the project. They bring local insights, cultural understanding, and lived experiences. They got into places and spoke to people that we would never have heard from otherwise. They possess intimate knowledge of community context, ensuring cultural sensitivity. And they're just great at talking to people. We also did some work with this around with appreciative inquiry, which is a method of going out and talking to people and collecting data from conversations, then looking at that thematically and bringing that in, and that really supported our work as well. And achieving digital inclusion requires a balanced approach, respecting individual preferences. User-friendly design, flexibility of service delivery, and technical issues need to be addressed. Education training is really important, and we aim to create a future where technology enhances and not replaces personalised and compassionate care. And finally, we need to develop an inclusive and responsive digital landscape for diverse community needs. And I think that's it.
Okay, so my name is Joyce Coker. I'm a researcher based at Cambridge Public Health. I'm going to tell you about one of the studies I've been working on for the past 2 years. We call it the Digital Assets Study. It's a partnership between University of Cambridge, Newcastle University and Imperial College London. And the research really focuses on looking at the ways community organisations use digital technology and the impact that has on people's mental health. I'm going to talk less about mental health and talk more about digital today in keeping with the theme. I don't think I need to give this definition, but just to say that when I do refer to community organisations, I'm not talking about anything NHS-based or anything in traditional healthcare settings. We're talking about community centres, faith-based organisations, charities and the like. So what we do know, and what a lot of you on the call would know, is that during the pandemic, community organisations, like all the rest of us, had to innovate. They couldn't provide in-person support, so they had to switch to using digital tools, so using Zoom, Microsoft Teams, those kinds of things. We do know there is evidence that suggests that digital technology can support mental health and well-being. So, for example, we know it can improve access to information. That can be good and bad, because not all information is right or is healthy or has good benefits. We also know that digital technology can facilitate social connections. It can allow people to maintain some contact while they can't be together in person. But like Karen mentioned, we know digital technology is not accessible or useful to everybody. We know some people don't have access to digital tools, so to a smartphone or to reliable internet. We know some people aren't confident. they're worried about clicking on the wrong thing or getting hacked or scams. We know some people are just not interested. They don't want to use digital tools, and that's also fine. So with this study, we wanted to explore the impact of how community organizations use digital technology, like how do they use it to support the mental health and well-being of the communities they provide care for. And for this particular study, we really wanted to focus on people who are less likely to use digital technology. We also wanted to focus on people who may be more likely to experience disadvantage in society. So we specifically wanted to focus on older adults, people from minority ethnic backgrounds, people with lived experience of poor mental health, people living in areas of deprivation or in low-income households, and people living with disabilities. That's in purple because with all the research we do, we have a panel of public partners, so members of the public who consult with us, who we go back to and say, we want to work on this, what do you think? And one of the things they flagged to us was that we really needed to focus on people living with disabilities. And we did. So on the screen, you can see some of the community organisations across Cambridgeshire that we partnered with during this study. Okay, so what did we specifically want to look at? We wanted to look at whether and how community organisations use digital technology to provide support on a regular basis. So we wanted to look at what community organisations did during the pandemic, and we also want to look at what they're doing now since the pandemic. So have they gone back to in person? Are they hybrid? Have they remained online? We wanted to look at whether and how community organisations use digital technology to help people form meaningful social connections. So referring back to what Karen said, how are we still able to maintain those meaningful social connections? We also wanted to look at whether the increased use of digital technology is unintentionally leaving some people to become left behind. Again, something Karen had touched on earlier on. And we want to see if that actually increases people's risks of poor mental health. But we also wanted to see if the flip was the case. We wanted to see if the increased use in digital technology by community organisations has allowed people who previously struggled to access their services or their support actually engage with them. So for some people, has it actually been beneficial? Oh, okay. So this is what we did. Well, we had a two-pronged approach, but this was the first step. The first thing we did was a survey. On the screen on the right, you can see, well, I think it's your right, my left. You can see the front page of our survey. So we had 50 tick box questions, so people didn't really need to write too much. And we had a variety of ways of delivering the survey because we wanted to be intentional to get the voices of people who maybe wouldn't normally engage in research. So we had paper surveys that we sent to community organisations. They could post it out to their members. So we would create a study pack, have everything in it. We had a little thank you gift and we would put stamps on it. It had a stamped address return envelope and the community organisations could post it out to their members. So we didn't know their addresses. I just make up packs, give it to the community organisations and they would send it out. So this was our survey. We had various ways of delivering it. There were three things we really wanted to pick up on. So we wanted to look at people's access to digital technology. We wanted to look at people's literacy, so how confident they were using it. And we wanted to look at digital assimilation, so the extent to which people are actually using digital technology to communicate with people, to enhance their social connections in everyday life. And I should say this study was run across London, it was run across the east of England, the West Midlands, North East and North Cumbria. So this is a flavour of the overall study, and then my next few slides I will speak specifically about the east of England. So far, well, this is based off of our data from last week. We have 348 members of the public who have taken part in our survey. So all the groups who are interested in older adults, minority ethnic populations. As you can see from the age range, we were quite keen. Yes, we did want older adults, but we wanted a good range across the life course. And as you can see on the screen, we've got that. Unsurprisingly, we recruited more females than we did males. So in the next couple of weeks, we're trying to intentionally recruit more males. And as you can see at the bottom, we got a good spread of ethnicity, a good spread of socioeconomic status, and 38% of the people who took part in the study so far, it's still ongoing. I think as of yesterday, we're on 425 or 427, something like that. But of the 348 I looked at last week, 38% of them said they do have a disability, and 36% of them said they've got poor mental health. Right. So this is a sample based specifically on older adults in Cambridgeshire because I kind of wanted to give an East of England feel. As you can see, we've got a this is an older adult population. Again, we got more females than we did males. We are working on that. Our sample in the East of England so far has not been very diverse, but I don't think that will surprise most people on the call. It's predominantly a white sample. Most people in it are retired, and almost half of them have a university education. So I wonder how many of you would be surprised by this. We asked people if they had access to reliable internet all of the time. Just over half said all of the time. Most of the time, 40%, some of the time, 4%, and never was 4%. When you look at all of the time and most of the time together, it's 92%, and that's a decent figure. But we did find it interesting that of people who said they have reliable internet all of the time was just over half. We then also asked people if they had access via support from family and friends, but this was you in and of yourself, whether that is asking a friend for help or you on your own. How often do you have access to reliable internet? And just over half said all the time. We then asked questions about people's digital literacy. So we wanted to know how confident people were using various types of technology. So we asked, without someone helping you, can you look up information on websites? Most people could. Interestingly, keep in mind that this is an over 65 population. 63% of them are actually quite confident on social media, which I think is a figure people often underestimate when it comes to older adults and their use of digital technology. 70% of them felt comfortable installing apps and using apps for messaging. And I would like to flag the use of video calls, because I think a lot of the ways we engage with support and services are sometimes Zoom, MS Teams, video conferencing, and that seems to be the poorest skill that people had in the population we were looking at, so older adults in Cambridgeshire. And again, I'd like to refer you back to the fact that this was a very educated population, and still just over half of them actually struggled to use video conferencing technology. I won't dwell too much on this given time, but we asked people how they engage with people in their everyday lives. So not thinking about community organisations, how do you engage with family and friends? And that's just a snippet of what we found, but I won't talk too much about that. I would like to ask you all a question. And if you feel comfortable to drop your answer in the chat, we asked people during the COVID-19 pandemic, did you digitally access? So did you use a smartphone? Did you use your laptop? Did you use your iPad to digitally access support or services from community organizations? So this could be advice on a website. This could be joining a coffee morning online. And I'm just wondering if anyone wants to feel bold enough to drop an answer in the chat as to what proportion of people you thought said yes before I go on to the next slide where I show you what we did find. So I'll give it a quick minute to see if anyone has any thoughts and wants to drop a number. 85%. Nice. Any other thoughts on what proportion of people said they did? 72%, around 70, 65. Okay, I'll go lower than that. This is what we found. Wonderful. We found that 35% of people said they used digital technology to access support from community organizations during the pandemic. That has gone up to 41%. So we asked people during the pandemic, what did you do? And we asked them at the time of filling the survey, which has been from June to it's still ongoing at the minute. Yes, we did define digital technology, Philippa. We have a definition at the bottom to say it's using an iPad, it's using a mobile phone, it's anything other than in person or a phone call. So text messages were not included and telephone calls were not included. We did have that definition in there. Thank you for cross-checking. So 35% were the only ones who did, and that's gone up to 41%. And as you can see from the pie chart, we actually asked people, so what kind of support did you receive, or what kind of services did you engage with? The highest proportion we found so far is for people who use it to access information on web pages. And if you think back to the previous slide where people said actually that was the thing they were most comfortable with, using it to access information. And we've got a very small proportion of people who used it for counselling support. We had a variety of things come up. So we had online choirs, online exercise groups, but we tried to condense that into small proportions. So this research is still ongoing at the minute. I just wanted to give you a quick flavour of what we had so far. And before I stop, I wanted to highlight the work of the RDN. They used to be called the CRN, the Clinical Research Network. We have partnered with them throughout the study. So one of the things that's been happening is every community organisation who's engaged in this study has received £200 for taking part. That's been something that RDN has supported, and I just wanted to flag up what they do in case anyone was interested. So they partner with researchers, they partner with anyone doing research, and they provide support to help your research get done. Some of that is financial, some of that is they have links to a variety of community organisations. So they've been boots on the ground when I haven't been able to go somewhere to actually speak to members of the community organisation. But I'll stop there and just say the study is ongoing. We are picking up some very interesting questions about loneliness and social isolation and whether engaging digitally has actually impacted that. But in the interest of time, I'll stop there, and I'm happy to take any questions later or email me if anyone has any thoughts.
So thank you, everyone. It's been great listening to the other talks so far, and I think, yeah, continuing the overlap here with some of the topics that we've touched on already today. So I'm Alison Tingle, and I'm a researcher at the University of Hertfordshire, and my talk's about the DITSO study, which stands for Digital Technologies to Support Social Wellbeing of Older Community Dwelling Adults in Receipt of Social Care and Their Carers, all of which is a bit of a mouthful, which is why we shorten this to DITSO. So as a bit of background to this, DITSO is one of 5 research projects that sits within the National Priorities Programme for Adult Social Care and Social Work. And this is an applied research collaboration, meaning that it involves different university partners across England, and it's funded by the National Institutes of Health and Care Research. As a bit of contextual background, there's currently considerable investment towards digital technologies in adult social care, and these are being seen as crucial to support the sustainability of health and social care systems. Yet, despite policy documents referencing the need to ensure that technology reduces rather than exacerbates loneliness and isolation, there's still very little focus on how this is actually going to be achieved. In fact, contrastingly, it often seems that technologies within social care are being introduced to support goals of around improved service efficiency and reduction of resources, rather than focusing on the outcomes of individual well-being. Added to this, we know COVID accelerated the adoption of digital technologies, but in quite a rapid way, and often leaving gaps in our understanding about how these work and for whom. So with this in mind, and aligning with the national priorities aim of supporting evidence-based service change, the DITSO project set out to map, explore and support the implementation of digital technologies that contribute towards social wellbeing in this context. So we started with a literature review and a horizon scan of different technologies that are being developed to support social wellbeing in adult social care. We then conducted qualitative interviews with 24 professionals who worked in roles related to adult social care, technology development, and with people from organisations who support older adults in the community. We also spoke with 39 older adults who were either current users of adult social care and or had determinants of poor social wellbeing. We did within this try and speak with people who were engaged with digital technologies and those that weren't, but it was much harder to get involvement from the latter part. To both groups, we asked questions to explore if and what and how technologies were being used or developed for older adults, and how they were being implemented within adult social care, really just to better understand current ambitions, facilitators and challenges as well. In our final work package, we ran a series of knowledge mobilisation workshops to sense check our findings with all the relevant stakeholders and develop some recommendations for policy and practice. So in the next 10 minutes, I'll kind of share some insights from each of those work packages, really. It's probably important to also note that we made the decision to keep our definition of digital technologies really broad, to be inclusive of commissioned technologies such as remote monitoring, assistive technologies like screen readers, and also consumer technologies like mobile phones, apps and smart technologies. So yeah, that's a bit of the background. it's also probably important to highlight how kind of public involvement has been really key to the whole of this project. And fundamental to the National Priorities Programme too. Initially, areas of research were prioritised in consultation with practitioners, professionals, academics and people with lived experience. A strategic lived experience group has been set up for the whole of the programme, and each of the 5 research projects sought their own local public involvement, interestingly in completely different ways. For DITSO, we recruited initially 6, now 8 older adults who brought to the project different experiences of social care, of digital technology use and of social wellbeing. And I've met with this research group every couple of months, and they've contributed greatly to all aspects of the project. One example of this is they co-designed our definition of social wellbeing, which is on the slide now, and this was done because it's quite poorly defined in the main, and that has real implications to both understanding of how technologies can support adults' wellbeing, but also the robustness of evaluations which are needed for wider investment and adoption of that in social care. So kind of moving on to some of the findings, we found many ways, as kind of Joyce alluded to, that digital technologies are supporting social wellbeing and enabling people to live more connected lives. Access to the internet was frequently broadening people's communities and enabling adults to engage in a wider range of groups and interests beyond what they could access locally. At the same time, online platforms like Facebook were also keeping people abreast of what was happening in their local vicinity. We also found that digital technologies, from kind of smartwatches to shopping apps, were supporting people to continue living at home independently without the need for additional care. I think it was quite interesting that these kind of everyday type of technologies was pretty much solely what the older adults told us about, as opposed to technologies that were being commissioned by adult social care. And in the main, they were privately brought rather than funded for them. So as one of our older adults said here, they make my life more fulfilled, definitely more fulfilled. It sort of stimulates your brain, increases your knowledge of things, increases your ability to talk to other people, have conversations. It enhances the whole quality of your life. But this was not a unanimous finding. We also learned that technologies can be a considerable source of stress and poor well-being, particularly when adopting them or when things go wrong with them. And virtual platforms were often seen as second choice to in-person contact, which offered better depths of conversation and encouraged people to go out into the community, which in turn really supports other well-being goals like mobility and exercise. As you'd imagine, and is only right when discussing digital technologies, there was a lot that related to digital inclusion, digital literacy, and digital poverty. And this table shows some of the factors that the older adults we spoke to felt were supporting and challenging technology use. Factors that were supporting inclusion included having personal resources, a supportive network, personalised training. So this kind of really echoes a lot of what Karen said, and the training need to be pitched at the right level. People also need to see the value in technology, kind of, i.e. what would it add to their lives? And there needed to be a kind of a confidence about using new things. And we found that often having a familiar feel to things helped that. In relation to the challenges, there's lots of anxieties and for some first-hand experience related to being scammed and exploited online, which was exacerbated by people not knowing where to get accessible information to stay safe, and fears over privacy and security of technology, and increasingly of AI as well. The language that people used when talking about technology, the pace of technology development were also further barriers. We've put infrastructure on this slide, and that really relates to the ability to afford and access both Wi-Fi devices and Wi-Fi itself, and this remains a significant issue for many. And I noticed in the chat there was stuff about being funded properly. But added to this, that it was also that kind of personal choice to become digitally included. And for many, this just wasn't of interest. They didn't really see that it had relevance to them and wasn't something that they wanted to engage with. Despite numerous innovative community-based projects to support inclusion, we really did find that got the sense that digital inclusion is persisting and no doubt exacerbating existing inequalities. Our research also highlighted that digital inclusion, like it's been touched on already, can't really be thought of in simple terms of having a device and Wi-Fi. There's lots of subtle layers of inclusion, and navigating devices, platforms is increasingly a necessity to get to many public services and spaces. And the consequence of this is that being digitally excluded is probably at best narrowing people's choices and resulting in slower, sometimes more expensive access to services, and at worst it's probably excluding those who need it most. And these frustrations were expressed through the kind of quotes we've got here, that you're either being forced to keep up, or if you're not able to get in line, you're beginning to feel like a second-class citizen. As Adrienne says here, she felt like she'd been shoved on the scrap heap. So when considering the perspectives from professionals, digital platforms are enabling them to reach more users of social care earlier in the journey. And as with older adults, it was felt that there's plenty of potential for technologies to delay the need for social care, but this wasn't fully realised yet. And there's also excitement within social care around the transformative nature of AI to revolutionise how data is being used and to better target care and support. I think, as with older adults, professionals acknowledge that the landscape is rapidly moving and it's a changing field and increasingly competitive. All of that supporting the desirability of technology, reducing stigma of it to support care needs. But it's sometimes in early iterations and not always meeting the needs of older adults. And I think it was also felt that all these innovative ways that people are using it aren't really, the information isn't out there for everybody, and both older adults and staff perhaps feel under-equipped to be able to make technology recommendations in their day-to-day roles. For technology ambitions to be realised, there's probably the need for more evidence. Social wellbeing is difficult to measure though, and there's an over-reliance on pilots which have neither longevity, budget or expertise to build a better evidence base, and this is impacting the whole infrastructure from technology developers to social care commissioners to those delivering social care and also the end user. So we kind of tried to bring all this information together to those who are impacted by it, and we held some knowledge mobilisation events loosely based on World Cafe formats to share some of our findings and make viable recommendations for policy and practice. In these sessions, we discussed these three topics. The first around how to support digital inclusion without exacerbating the exclusion of those that choose not to engage. The second around social wellbeing measures. The third was around the support of co-production of digital technologies to ensure the design is inclusive and that technology is easy to use and the right technologies are being commissioned. It was important to us that there was representation from a range of stakeholders, from older adult tech developers, people working in this field and in the voluntary and community sector. And as you can see by that pie chart, we managed to get quite good representation. And our research advisory group worked with us to make sure that all the topics were accessible. So this is a very busy slide that I can't talk through all of it, but we had a graphic artist who attended our events to record our conversations. And although you can't see the detail, I kind of added this in because it gives a sense of that kind of energy in the room and depth of engagement on these topics on the day. And as well as being kind of that useful depiction of the topics, we found that having the artist present there really added to the event. It gave a focal point for conversation and that kind of validation of what everybody was also contributing on the day as well. So I'll finish quickly with some of our recommendations. So in relation to supporting digital inclusion, I think some of the key things here was around awareness and education, and this was a kind of strong theme throughout. From the professionals' perspective, it was kind of needing to better understand why service users may feel excluded from technology adoption and the barriers faced by different groups of older adults. And for older adults, it's around that lack of awareness of how technologies might support them to do the things they want to do in their life and who to ask for help. I think there was also a focus on accessibility, and again, there was kind of several layers of that, ensuring how it can be used with ease, regardless of ability or disability, and that technology must be spoken about in a language that everyone can understand. Security and privacy concerns do need to be better addressed. And kind of, yeah, lastly, but perhaps most importantly, those equitable non-digital routes to access services are essential, and they must be protected and made visible. In relation to the social well-being, there needs to be a clearer focus on measurable outcomes of a technology, such as connection to friends and family at the outset of design, and that would support implementation evaluations. There were also suggestions around standardised routine data collection about quality of life that would help this, and perhaps that there's a role for both the technologies and AI in that. And finally, when considering working more collaboratively to co-produce and design technologies, the starting point has to be that technologies need to fit with what people are already using, and there was a strong message within this to kind of try and reduce complexity of technologies, i.e. the number of functions, and improve that interoperability, i.e. how technologies all work together. It was also acknowledged, and again, Karen mentioned this already, that kind of all stakeholders have a crucial role to play, commissioners, developers, huge value in the community organisations and all that knowledge and access to communities that they have. And there needs to be input from a diverse range of older adults to support technologies being more accessible for wider groups. And yeah, just that kind of nod to the fact that actually this all really takes a lot of time and resources, and that is a bit of a challenge in the current climate as well. So yeah, thank you all for listening. Here are some more of our details, and just to point out that the views are my views and the research team views, not necessarily that of the LIHR.